My name is Deidre Flanagan. I am the General Surgeon and Trauma Director at Moab Regional Hospital in Moab, Utah. I don't really remember a time when I didn't think that I wanted to be a doctor. I'm kind of a fixer, and I'm into math and science, and so it was a logical thing. And there are some physicians and people in healthcare in my family, so I had a little bit of that background as well. I think that trust is a two-way street, and I think that's really important. When people come to meet me as a surgeon, I am frequently meeting them at their most vulnerable. And even though they may not have anything that's life-threatening, that doesn't mean it's not a big problem or issue for them. That doesn't mean it's not a scary process. Nobody wants to have surgery. And so I think establishing that communication so that I can meet people where they are, listen to what their needs are, listen to what their fears are, listen to what their goals are for whatever it is that we're going to do. And then I can communicate with them about what I have to offer, how we're going to do things, what we're going to do, the pros, the cons, the alternatives. You know, I always tell people, this isn't my surgical problem, this is your surgical problem, so let's work together to figure out how we're going to get the best outcomes. I think that it's the ability to impact people's lives in a positive way, the things that I can fix. In surgery, we do a lot of that. People come with a problem that they have. Their gallbladder's bad, they have appendicitis, they have a hernia that bothers them and keeps them from working. Maybe they have a breast cancer or a colon cancer. Maybe they just have mold they don't like that they want off. You know, things from small to large, but they're important things to them, and I can change those things for the better most of the time for people, and hopefully get them to a better place than they were where they started with whatever their problem is, and I find that rewarding. I really was excited about the smaller hospital. I came from a bigger city and a much bigger hospital and a much bigger healthcare system, and there are good and bad things about that. But I was excited about being able to come to a smaller hospital in a smaller community. It's a tight-knit group of people who work well together. They're friends as well as colleagues in many circumstances. And I'm impressed by the level of care that we can provide here, despite the fact that it is a small community and it is a small hospital. The physicians and the leadership are progressive. In all honesty, it's really exciting the things that we can do here, and I think that's good for the community. It's hard to leave for healthcare. It's hard to leave for surgery and have to do that kind of follow-up and travel. And so I think everything that we can reasonably and safely do here ought to be done here, and that's my goal.